Hi, I am Dr.Teegala Anitha Reddy. I am a high-risk pregnancy specialist at TCare Icon Hospitals. Today we will be discussing about high-risk pregnancies and how to avoid high-risk pregnancies. So for that, first of all, we have to know what high-risk pregnancies are. High-risk pregnancies are examples of medical disorders in pregnancy and any placental disorders in pregnancy, and especially we have to know that repeated abortions also fall under the category of high risk pregnancy, and also preterm labor, premature deliveries and any other bad events during pregnancy are high risk pregnancies. So for this we have to know that how to avoid high risk pregnancies. High risk pregnancies can be avoided, and the time for consultation starts right before the confirmation of pregnancy. That is, even before the lady is pregnant, if she knows that she is suffering from many medical disorders. For example, if a lady is suffering from diabetes or hypertension before pregnancy, she has to seek the advice of a gynecologist prior before she has become pregnant. That is called as periconception counseling or periconception advice. So for this, the lady has to go to the doctor. She has to get her blood sugar level checked, and she has to confirm that the sugar levels are normal, because this periconception period itself is very valuable and it's very precious for the baby, because the initial stages of formation of the pregnancy should be very normal, so that the continuation of the pregnancy is very normal and it goes till the end very safely and smoothly. Likewise, even for hypertension, if a lady is pregnant, before itself she has to go to the doctor and she has to see the doctor and ask the advice of what are the valuable measures to be taken to avoid of increase in the blood pressure. For that, necessary blood tests, investigations or any other investigation procedures have to be adopted by the patient. And also we have to know that other medical disorders like hypothyroid or any other hormonal problems also, they fall under the category of high risk pregnancy. So for that also, timely medication should save the pregnancy from going into high risk pregnancy. And also we have to have an account of repeated or threatened or recurrent abortions. These repeated abortions also fall into the category. So we have to know that what is the cause of this abortion. If at all a lady is having repeated abortions, we have to think that there is some common cause which is causing pregnancy to be aborted. So we have to find out what that cause is, go for some investigations, get a proper doctor checkup done and try to avoid this cause which is leading to repeated abortions. Also, if there is any repeated premature delivery or preterm labor, this factor has to be corrected. Take proper suggestion and take the proper treatment of the consultant doctor and try to prevent this premature labor or delivery, because a healthy baby is always has a healthy life. So this premature deliveries also have to be avoided. And also in premature delivery, we have to see that proper treatment and appropriate bed rest is also very important. And one more category of placental disorders. We have to have an idea that placenta previa is a condition where the placenta is located in the lower segment of the uterus, where this leads to bleeding disorders during pregnancy. A lady will have bleeding per vaginum. So this is hazardous for the pregnancy. So proper precaution, bed rest, proper treatment has to be taken by the lady for these placental disorders. Also, intrauterine growth retardation, that is called as IUGR in short term. This is no proper growth of the baby in the womb. The baby doesn't grow accordingly in an increasing manner. So this has to be detected by the doctor. So for this, timely checkups have to be maintained, and when the doctor detects that there is intrauterine growth retardation, proper treatment has to be taken, because a healthy baby has to be delivered ultimately. So for this, for all these high risk pregnancies, the pregnant lady has to know that, especially in the rural areas where they have low nutrition and people are not aware, you know that India consists mostly of the rural areas. So for this, the pregnant ladies should have timely antenatal checkups. They can have one checkup every month up to 7 months. After that, till 9 months, they can go to the doctor once in 15 days. And after 9 months onwards, they should go at least weekly once for the doctor checkup. So during this, all the avoidable bad factors can be prevented. So a proper checkup, investigations and timely treatment from the doctor can prevent high risk pregnancies.